Good evening. I'm Mayor Ron Nirenberg with Bexar County Commissioner Justin Rodriguez, and we're joined tonight by Dr. Anita Kurian, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 132 new cases of COVID-19, which brings a total to 202,981. Our 7-day rolling average is now 160. Fortunately, we do have no new deaths to report tonight, but please keep, again, those families who are grieving in your prayers this evening. Every one of these numbers, again, is a loved one lost, and we want to remember them. There are 183 COVID-19 patients in our hospitals tonight. That's, again, a low number. It's stabilized over the last couple of days. In the last 24 hours, there are 30 new admissions, 63 patients in the ICU, and 37 patients now on ventilators. A vaccine update now. As of yesterday in Bexar County, 428,643 people have received their first dose, and 239,595 people have been fully vaccinated in our community. Again, please continue to wear your masks as we get more vaccines into our community and get those out. And I do want to give you now an update on what you heard yesterday with regard to Alamo Dome appointments. Metro Health will open 30,000 COVID-19 vaccine appointments at its Alamo Dome vaccine site beginning tomorrow at 7 p.m. You should have gotten a text alert already about that if you're signed up for the text alert system. Again, that's tomorrow at 7 p.m. These doses are reserved for those who are 50 years or older or those who have underlying health conditions. The San Antonio Metropolitan Health District continues to work with state and local partners to distribute COVID-19 vaccines to critical populations within the phases designated by the Texas Department of State Health Services. The appointments available will be from April 6th to May 1st, and you can visit covid19.sanantonio.gov starting at that time tomorrow to register for an appointment. If you do not have internet access, you can book your appointment by phone by calling 311 and the COVID-19 hotline. And the hotline operating hours are Monday through Friday, 8 a.m. to 5 p.m., and Saturday and Sunday from 8 a.m. to 12 p.m. Remember also that you can subscribe to the text alerts that alert you to when vaccine appointments will be coming available, and that's by texting vaccine or vacuna to 55000. Let me turn it now to Commissioner Rodriguez.
Great. Thank you, Mayor. And those numbers are looking good, as you mentioned. Stable numbers with respect to both COVID positive and the hospital numbers. That's great news. The vaccination numbers, as you mentioned, of those 428,000 or so, about 235,000 have been done by University Health there at Wonderland Mall. They continue to do about 5,000 per day, a pretty good clip. It's very, very efficient. I know I've been over there a number of times, as has the mayor. And we also know that on Monday, everyone becomes eligible for the COVID vaccines. We know there's still a limited supply, so it's going to be difficult. But one of the things that Bexar County Hospital has done, University Health, is to help prioritize those that are 80 and over. There is a special online registration process for those individuals. Again, those are folks that are 80 and older. They're placing a high priority on making sure they get vaccinated. So if you'll go to the universityhealthsystem.com website, click on the yellow banner starting tomorrow, the 25th, you can, those that are, again, 80 and over, have someone help you do that, a family member. You can get registered in a priority line, essentially, for your vaccine. So some good news, good work that University Health's doing. Let's keep up all of our masking, social distancing. The numbers are looking good, but again, we still have a lot of folks in town for Final Four. We just had spring break, and I think as long as we continue to comply, hopefully there's light at the end of the tunnel. So thank you, Mayor.
Great. Thank you, Commissioner. And again, as a reminder, if you are struggling through this pandemic with paying rent or mortgage, there is assistance available for you by calling 311. You can get access to our emergency housing assistance program done in partnership between the city and the county. Also, if you're out of work and without an income, you can sign up for our training program, which is training for jobs that are available and open today in our community while you receive a stipend to make ends meet. You can get more information by calling 311 or enroll at 210-222 824-HELP. And we do want to make a final plug again for the emergency that we're having with the blood shortage here in our community. If you're able to make an appointment to donate blood, we desperately need you to right now. You can go to southtexasblood.org or make an appointment by calling University Health. We need that donation. Supplies are at critical lows, including type O, which is used in emergencies. And as always, you can get the latest on COVID-19 on our community by texting COSA-GOV to 55000 or by going to the website covid19.sanantonio.gov. We're doing very good as a community to protecting each other, but we are also calling on our federal and state governments to help us with vaccine supplies. We still need those to come in more abundant numbers as we continue to protect ourselves. So mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Curie and myself and the Commissioner are available for questions.
Speaking of the federal government, Commissioner Rodriguez, we saw reports earlier today that the Biden administration told members of Congress that they are looking at the Freeman Coliseum, or will use the Freeman Coliseum, and potentially house up to 3,000 unaccompanied children who have come across the border. Has the county heard anything from the Biden administration about using the Freeman Coliseum as a temporary shelter?
So, Joey, there have been some discussions. I've not been in direct contact with the Biden administration, but I know Judge Wolff has been in some discussions with the folks at the Freeman. Nothing is solidified at this point. I think there's discussion of potentially housing up to 2,100 is the number I heard at Freeman. Again, this is a humanitarian effort. I think we're dealing with children. Our community has stepped up time and again to help those in need, and so at this point, nothing is final, but there are some ongoing discussions.
And well, this question might be a little too early, but any idea of what COVID precautions might be there? If you're having that many people, like that many children in a group setting, and any thoughts about COVID precautions and keeping them separate from each other?
So what I have heard is they are being tested for COVID at intake before they actually are transported to here or any other location potentially, and then they are talking about if this goes forward, having a separate area for those who may be tested later and need to be quarantined there at Freeman. So my understanding is all of those things are being taken into account, different precautions. Ultimately, it's the safety and reunification of these kids with their parents or guardians is the goal. But I understand all those things are being discussed over the next couple days.
Is there a deadline for those discussions, for a decision to be made?
I don't know if there's a hard deadline. I know that there's going to be more discussions tomorrow. I think I would say, certainly by Friday we may hear something more certain. That's not necessarily a hard deadline. It may be more artificial, but I think there's discussions over the next 48 hours for sure.
Commissioner, Sheriff Salazar sent you and your colleagues a letter stating he was against migrant housing and mentioned not having enough manpower to provide security. Could you give us your thoughts on his position?
Yeah, I mean, certainly I have not spoken with the sheriff. I did get his email. He's certainly entitled to his opinion. To my knowledge, he has not been contacted, or his department has not been contacted to provide any services at that site. What I understand is if it is a housing site for these kids, that DHS, the feds would be in charge of that. But again, I'm not talking to the sheriff directly, but I did receive his email and certainly respect his opinion.
Have any of you spoken to local organizations about possible additional housing and assistance once migrants arrive? I've not
had any discussions directly with any organization. There have been some community organizations that have reached out to my office to have discussions about, security, health conditions, safety. Those are all of our concerns, and I think they're the community concerns as well. And I think that's part of why we're having discussions over the past couple days and going into the latter part of this week is, ultimately we want to make sure that this is a temporary situation, that we get these kids back in the arms of their loved ones. And so I think there's a number of organizations that have reached out that want to be a part of the solution here in San Antonio.
Hearing 30,000 vaccine doses over about 4 weeks sounds like a decrease in allocation. Are the coming allocations the same as what we've been getting, or are they more or less?
I can't definitively say what the future allocations is going to look like, but we have been receiving about 10,000 doses on weekly basis. So the 30,000 may seem 10,000 less than the previous release, but that was because the previous release was for the 4 weeks time frame. This release is for 3 weeks. So the allocations are pretty much steady.
Has there been any confirmation or other indication that, as the state said in its press release yesterday, that the supply will increase?
We haven't gotten any notification from the state yet, but again, they put out the allocations list on Monday mornings, so we'll know more on Monday.
Yeah, and let me be very clear. We have made our voices heard consistently every single day to our federal government and our state government that we need more vaccines. There has been now a rolling up of the mega sites, the super sites that FEMA set up. We are asking for the next round of those, one of them to be located in San Antonio. We need more vaccines, particularly as eligibility opens up.
Another question about Freeman. Is it still set up as a field hospital right now? And if not, when will it come down?
You know, that's a good question, Joey. I did talk to Derek Howard over there today. I believe it still is set up as a backup potential for beds, at least structurally, but that can be converted pretty quickly. But our plans are to go and I know I talked to Nelson today about getting over there and taking a look. But I know it has been set up, and I think still is, for that backup possibility, even as we kind of inch out of certain the red range with respect to our trouble with hospital beds. But it is the professional operation over there, they can convert that pretty quickly.
Commissioner, you said University Health will prioritize senior citizens over 80 starting Monday. Why hasn't this been done earlier, before eligibility opened to everyone?
So it's good question. I think part of it is just volume, and as more volume become available of doses, and I think in anticipation of the higher demand, right? We know Monday, everybody's going to be eligible. I think it's a kind of a point of inflection where we've got to make sure those that are most vulnerable are protected, and so that they decided to activate this, and I think it's the right thing to do at this time.
Last night, Dr. Bridger said people who are young and healthy should hold off on signing up at vaccination sites run by the city and county. For the mayor and commissioner, is this your official stance that young people should be discouraged from city and county run vaccination sites?
So let me say a couple things. Number one, tomorrow at 7 p.m., we're going to open up 50,000 appointments for those who are 50 and up, or those with underlying health conditions. That's the eligibility right now when those 30,000 are open up. Starting Monday, everyone in the state is eligible for vaccines. We want to get as many people as quickly as possible vaccinated in this state. So if you're eligible for a vaccine, go and get an appointment.
Something that came out of the pandemic is actually House Bill 1024, which would allow for alcohol to go to become a permanent fixture here in the entire state of Texas. Today it took another step forward in passing through the House. Have you had a chance to talk to Governor Greg Abbott about this bill, since there has been some concern in the past with some groups about DWI rates?
Can you repeat that, Amanda? I'm sorry, I didn't get the first part of that.
Yeah, so House Bill 1024, which would allow for alcohol to go to become a permanent fixture in Texas, it took another step forward to passing and becoming law. Have you guys had any chance to talk with Governor Greg Abbott about that? Because it has been...
I have not. I need to get more information on that.
Yeah,
particular.
and I'm familiar with it. Essentially, it would they I guess there was an exception this summer that they wrote into the TABC regulations that allowed for alcohol to go sales. They're, I think, essentially trying to codify that this session, make it permanent law. And I guess the question is if there's concern about DWI-related offenses and things like that. I think there's always concern about that. I've not spoken to the governor's office about that. It seems to be to have been a very popular initiative during the summer for folks who couldn't go to their local restaurant or bar. But it sounds like it's picked up some momentum in the session, and it will likely pass. I think those advocacy groups should be at the table to make sure that it doesn't cause any other problems that are unintentional.
If this passes into law, could you see an increase in patrolling just to make sure it stays low?
Any increase in
Law enforcement patrol.
gosh, I think they would have to do a little bit more patrolling to make sure people are not consuming during transit, right? The idea is you can take it to go and then consume it at your home or residence. But yeah, we've not even had any of those discussions, at least at the county level.
Today marks 2 weeks since the governor scrapped the mask mandate and opened business 100%. Is it still too early to say whether that's had an effect on our COVID numbers? And since we haven't had an increase, are we able to be cautiously optimistic at this point?
Well, I think it's always right to be cautious about your optimism, but I will say that the reason why we're talking about this every day is that we are trying to appeal to people's common sense. Now is not the time to let down all of our guard with regard to COVID. So we're asking people to keep their masks up, and I'm thankful that we see a vast majority of folks out and about protecting themselves, maintaining their social distance or mask wearing as necessary. So I think the reason why you're not seeing the spike is people are still doing their part to protect one another.
On that note, it has been 2 weeks since spring break had officially started. Last week, obviously, there were some spring breaks. There's still some more scattered out until April, early April. The biggest piece of advice, obviously, that we've heard time and time again has been be smart, be safe, think of one another. But when you do see the trends staying in the mid to low to maybe high 100s, is that encouraging, thinking that we are moving in the right direction?
Well, yeah, certainly, but I think it's reinforcing good behavior. We have been benefited by the fact that while there's, chaos from the state, federal levels with regard to a unified response to this pandemic for a year now, relatively, that we've had a consistent approach from our community to protect one another, and I think that's what's saving us. But to your point, Amanda, I don't think we can be sure about the effects of the mask mandates being lifted for a while yet, because we're just now, we're not even into the period where we can see what's happened during spring break.
Dr. Kurian, have hospitals in San Antonio been able to close their COVID units as hospitalizations have decreased?
Some of them have, but I don't have the exact number of how many. But I know many of them have sent their contract staff back. So yes, some of them have closed down their COVID units, but I don't have the exact number.
That's all we have tonight. Thank you.